So gum recession, periodontists, you get a lot of patients and they go to you to fix the gum recession.
We do, yeah. And there's a couple ways of doing it. The traditional way was, used to be most of the time go to the palate, harvest tissue from the palate, which creates its own little surgical site and sore spot, and then put it where you're going to put it, wherever that be.
To patch up the part that's receding.
To patch up the parts that's receded. And generally, patients will have a complaint of cold sensitivity or their gums hurt. And they can see it in the mirror. They're visibly, the gums are pulled down.
Okay.
And maybe they got a little muscle pull, little frenum attachment, we call it, and it's not happy. They've lost some bone. We have a saying that as the gum goeth, so go with the bone.
Okay.
Which is not good, and that could lead to tooth loss.
So people with receding gums could end up losing their teeth.
Absolutely.
It's like an early sign.
Yeah, it's an early sign. If it goes on and on and on and left untreated, they could lose their tooth. Okay? So we do it, I would say 95% of the time we do it a little differently.
Okay.
We use what's called a pinhole technique. It's non-invasive. When the gums are receded, it's kind of like lowering a curtain down. So we actually bring the curtain back up to the gum line to cover those sensitive roots. But we want to keep it there, so we use techniques that allow us to bring the gum back up, thicken it, and we do it non-invasively through a tiny little access pinhole.
Okay. Based on what you're telling me, I mean, logically it makes sense why you would, in other words, if you could just pull the gum tissue down and keep it there, why isn't everybody doing it this way?
I think it goes down to people get stuck in their old ways, the way they were trained. So they haven't gone and taken the additional education, the continuing education, and the training to learn the newer techniques where you can do it more non-invasively.
So periodontists in Texas,
yes,
like thousands of this is a big procedure for you guys.
Yeah.
Thousands a week are having a surgery where they take from the roof of the mouth and then patch it on the edge.
Yes.
And only, I guess, a small percentage are doing this technique.
That's correct.
That eliminates that.
That's correct. Yeah. I happen to be one of them that believes in moving on, advancing, using the newer technology. In the old days, what we used to do, it would be hard to have patients come back to, if they needed more than one side of the mouth to do grafting, because of the discomfort with harvesting from the palate, they wouldn't come back for the second round.
Okay.
But with the newer techniques, the non-invasive pinhole technique, you can do multiple sides. You're not limited to just to do 2 or 3 teeth at a pop. You can do many, 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 many teeth in a row and get a whole lot done at one time.
So no more, the cold sensitivity goes away right away?
Yes.
Okay.
Absolutely, almost immediately. Well, immediately, really. So if you've been told you need the traditional type of gum surgery, you should get a second opinion. Insurance covers it equally, either way you do it.
So the pinhole technique.
Pinhole technique, non-invasive or minimally invasive pinhole technique.